We are all much more aware of how common mental health problems are. About 1 in 4 of us will have a mental health problem at some point in our lives, and about 1 in 15 will have a serious mental illness. But where we are lacking is in the size of our community teams. We have small community services. So our clinical strategy is to focus on building our community services so that we can support people better and support people with a higher severity of illness in the community. Now we have an opportunity with our estate's development to build a new hospital, and in our community buildings we can think about how we bring our teams together so that they can work in a much more integrated way, both with each other but also with partner organisations. When starting this project, it was very important for us to take along our service users, carers, staff and our local community.
I feel so passionately and so excited about this because one's environment is sort of so crucial to one's health and well-being.
But if they're in a building that's old and damp and dismal, it has an effect on their mood.
Some of our rooms are shared, so service users aren't able to get their privacy. We also have very limited access to outdoor space. Many of the wards have no direct access at all. And these wards can get very hot and stuffy, and the ventilation isn't very good.
One of the biggest challenges, I would say, poor ventilation, particularly in summer. This contributes to poor sleep.
One of the current challenges that we have is that we have 16 beds on the ward within only 4 rooms with en-suites. This means that the communal toilets are overused. The very old plumbing cannot cope with this.
Well, I've been involved in the design process from the concept at the beginning. I've attended all the workshops, which has been very informative and exciting. And it's also been a privilege as well, because this is a once-in-a-lifetime opportunity.
Service users have been involved from the outset, so in designing the service, we're ensuring that its access and its delivery is going to meet the needs of all those using the service.
At the moment our line of sight is very poor. We can't see exactly what's going on everywhere in the ward, whereas having a different environment which is modelled just for mental health care, it means that we will have better line of sight, we'll be able to see our patients clearer, and it will just improve a sense of community on the ward.
Our service users have told us they want single ensuite bedrooms, quiet rooms and access to outdoor space. They also want single sex areas. Other suggestions have included a gym, area for family visiting and a welcoming cafe in the reception area. We have incorporated all of these in the new design.
We engaged the UCL Bartlett School of Architecture to tell us what is available, what has been built elsewhere across the world, and this gave us a framework of how to think about building facilities for mental health services.
Because it's an urban setting, we have a multi-storey solution, and that has challenges particularly around access to fresh air. The solution we're looking at is a series of roof terraces which are safe and secure, which help to create a vertical landscape as part of the building concept. One of the other aspects is to have a cafe at the front to help create an active frontage and draw people in a welcoming manner. And this will also help to integrate the facility into the community and blur the boundary lines between the mental health facility and the community in which it sits.
The architects are great. They've listened to everything we've asked for. They've taken notes, they haven't just fobbed us off.
I mean, we've got involved with even the colour of the bricks, the size of the rooms, additional rooms. There's been so many things we've got involved with, and it's been exciting. I personally feel like I'm building the hospital myself.
Building new community buildings gives us an opportunity to think about the environment, so things like light, temperature control, also thinking about spaces for service users and carers to be able to use, enough consulting rooms, thinking about the other services people need in their recovery, and of course thinking about our staff, giving them spaces to relax in and also to get to know each other. I want to take this opportunity to thank everyone who has been with us on this journey so far. I particularly want to thank the service users, carers and staff who've been part of the co-design and co-production of this exciting project. I also want to thank the support that we've had from our partner organisations and the local communities that we have met with. And of course, I really look forward to working with everybody to bring this project to fruition.